All right, everyone, welcome to Dietetics with Mrs. Bhat. Mrs. Bhat, can you say hello?
Hello, everybody.
Hi, not many of us know what dietetics is, so could you kind of just like say who you are and what you do?
Okay, hello, everyone. My name is Charu Jain Bhat, and I'm a registered dietitian by profession. So, I was a registered dietitian back in India, and I was working with many acute hospitals in India. Then we moved to this country, and I wanted to pursue my career as a dietitian in this country. And I decided to go back to school. So I joined San Jose State University, where I did my master's. And after that, completing my master's, I wanted to do something in the area of food service because the clinical dietitian and food service goes hand in hand. Being new to this country, I wanted to have an idea of how the kitchen works, what are the regulations in the kitchen. So while I was doing my master's, I did my certification to become a certified dietary manager. And after completing my master's, I worked as a dietary manager in Mills Peninsula Hospital and then senior food service supervisor at UCSF Medical Center. After that, I thought I want to go back to my career of being a dietitian. And I went back to school at San Jose State University to finish more classes, which I was supposed to do to become a dietitian. And after finishing those classes, I joined my internship. And after that, I gave my license exam and I become a registered dietitian. After becoming a dietitian, I worked in many skilled nursing facilities in Bay Area. And currently, I work for one of the skilled nursing facility in Bay Area for last 6 years. And I'm dealing with a lot of COVID patients right now.
Okay, awesome. So we're going to be getting into a lot of COVID related questions as well. So I'm sure all of you participants know how these workshops work by now, since we just had one like 15 minutes back. We're just going to start off with me asking the questions that me and my partner came up with, followed by the chat questions and any pre-submitted questions. So without further ado, let's get right into it. So you mentioned COVID-19, right? How is dietetics important, especially regarding the current circumstances in COVID-19?
So, for the COVID 19, as we all know, there is no vaccination until now. Luckily, we have vaccination approved last week and this week, which will take some time, and COVID has been in existence since March. One of the side effects of COVID 19 is the patients, they tend to lose their appetite and they don't want to eat, and they are very prone to get dehydrated and malnourished. And the role of the dietitian is very important because there is no medication, there is no vaccination to treat. Only the nutrition helps in maintaining their adequate nutritional status so that they don't become malnourished and they don't become dehydrated.
Okay, awesome. So many people out here are picky eaters. So how do you deal with people who need to follow a certain diet but don't like the food that they're getting?
So, for those who are picky eaters, what I do is I discuss with them what they like to eat, what they don't like to eat. In our hospital, we do have different set of menus, the regular menus and the alternate menus. We offer them the menus. We help them picking up their food options from the regular menus and the alternate menus. If they don't even like anything from those food options, we give them other food options which they may like. And I also work in coordination with their families because some of them, they want family food, they want their cultural food, and then we coordinate with the families to bring the food for them.
All right, that's nice. I like how you work with other families so that you can provide food which the people will actually eat.
Absolutely. And I also give them nutrition education according to their medical conditions and their dietary restrictions, which help them in picking up their right choices of the food.
Okay, yeah. So as soon as you get a new patient, I'm sure you're already on the case, but how quickly do you have to plan a diet for a newly registered patient in your hospital?
So when we get a new patient, Upon admission within 24 hours, the nurses are supposed to give me the height and weight of the patient. Once I get the height and weight of the patient, I have to do the initial assessment of the patient, which means what is the prescribed diet, what is their height, weight, BMI, their ideal body weight percentage, how much are they eating currently upon admission, what are their labs, because labs plays important role if they have any kind of kidney function or failure or any kind of liver abnormalities, and what are the medications they are taking on, which helps in my assessment, because some of the patients are on psychotropic medications, which means they are on antidepressants or other medicines because of which they may be sleeping for longer time, or they may be on diuretics, which means water pill. And so I consider all kind of medications they are on. After that, my assessment, it starts. Also, it depends how soon I do my assessment depending on their medical condition. There are some patients, those who need immediate medical assessment. For example, if somebody is on tube feeding, now there are different kinds of feeding, if they are getting through the nose, through the stomach, or through the veins in their hand. So these kind of patients, they need immediate attentions. Other patients, those who need immediate attention is those who are on any kind of radiation therapy or chemotherapies or any other kind of radiation therapies. Those patients, those who are going for dialysis, they need immediate attention, because if they, the dialysis patients, they tend to get fluid overload fast, and it can affect their kidneys more. So it depends on their medical condition. Based on their medical condition, I assess my patients. And there are some patients, they are not eating good, so I have to give them the prior attention as well.
All right. So on to the next question. So of course you're a dietitian, but we need to know, how often do you work with physicians?
As a dietitian, it is very important role, because we all know the road to recovery is nutrition. And a healthy nutrition really plays an important role in recovery of a patient. So we work as a whole interdisciplinary team, which involves doctors, nurses, social worker, and rehab team, and we work together in identifying the goal of the patient. If the patient continues to lose weight or gain weight, I'm in touch with the doctor through text message or through phone, and the doctor responds back immediately. So it's very important for me to be in touch with the doctor or their physician assistant or their nurse practitioners, that if they are not eating, if there are any certain conditions, or if I observe anything which is unnatural.
Okay, that's awesome. So as many people know, some foods tend to cause an outbreak in disease. Like if a lot of you participants remember, E. coli, like not too long ago, caused an outbreak, caused an or was in romaine lettuce, and that kind of caused a big like situation with people purchasing romaine lettuce. So how do you, as an individual or as a department, stay up to date with new food trends, and how do you plan your patients' diets around
Okay, that's a good question. So I work in coordination with my team, which involves, I'm at the clinical front, and at the food service front, we have a dietary manager and an assistant dietary manager. So the food for the kitchen is being ordered by the dietary manager and the assistant dietary manager. So if there is a food which is recalled, so our food vendor, they give us a call with the recall item number, and then the dietary manager and the assistant dietary managers, they check from their inventory or from their invoices if they have received any food from that item number. If the food, that item is still in the department, we discard it immediately, and we tell the vendor that we have discarded the food. If the food has been passed on to the patient, then we act on immediately. I give the in-service to the nursing department to monitor the signs and symptoms of any of those diseases which can infect the patient. And once, if the patient has any kind of symptoms, I monitor those patients very closely, do their assessments again, check their weekly weights, and then until their symptoms disappear.
Okay, that's great. So on to another question. We kind of asked this in the last workshop too, but since it's a different professional, the answer will definitely vary. What does your average day of work look like? Are you always behind a desk or are you meeting with patients, going room to room? What does it look like?
So my average day, okay, it's a lot. In the morning, I begin with attending a meeting which has all the department heads from the different areas like social services, nurses, the hospital administrator, the director of nursing, the wound infection control department head, the medical records, rehab department. We discuss how we can improve on our services. Also, we discuss the critical patients in those meetings. After that, I see, I review the patients based upon the attention they require. I work closely with the patients and their families and with the whole IDT team and do whatever interventions and recommendations I have. After all that, I do my documentation, which is required to do, and give my recommendation to the nurses for MD to approve. In addition to this, I also attend the care conferences, which is conducted by the interdisciplinary team with the patient and the families, and we decide what is the goal of the care for the patient. I also have to attend some risk meetings, which means all the department heads, they come to that meeting, we identify those patients who are at risk, and then we have a goal to take care of that patient. In addition to this, the food service department has the dietary manager and the assistant dietary manager, but I am required to oversee the whole functioning of the food service department if they are following the right regulations in the kitchen.
All right, so that was the end of mine and my partner's questions. Now we're going to get into pre-submitted and from the chat. So I'll start off with a pre-submitted question and I have it jotted down right over here. So many of us know college paths such as surgeons and doctors, as mentioned in the last workshop as well, have kind of a stereotypical path to become what they are. Um, is there like a stereotypical path for a dietitian to become a dietitian?
Yes, there is. So if somebody wants to work as a dietitian, they have to undergo 4 years of bachelor's degree in under nutrition and food science. After doing that, there is a new regulation which is in effect that to become a dietitian, one has to have master's degree also. So they have to do master's degree. After completing all the coursework to be eligible to apply for the internship, they need to have certain GPA in order to apply for the internship. Once they are eligible for that, there are different internship sites which we have to fill and give interviews. When the internship site picks the student, then we have to undergo 3 rotations of internship. One is the clinical rotation, one is the food service rotation. In clinical rotation, we work under a registered dietitian, how to handle the patients clinically. Under food service rotation, we work under the food service managers, that how the operations at the kitchen front is being done, and we also help them doing all those. Then the third rotation part of the internship is the community rotation, where we work in the community, whether it is food bank or in the community service or in the school. Once we have completed the internship, the whole process takes approximately 9 to 10 months of the internship. Once the internship is completed, we are supposed to fill all the competences which are required to be completed by the end of the internship from American Dietetic Association, and we give the paperwork back to them. After they have verified that all the competencies have been achieved, then we are eligible to take the exam to become a registered dietitian. And once we get pass that exam, we are a registered dietitian. We get the license to work as a registered dietitian.
All
So
right.
the whole process is like approximately 4 years of bachelor's, 2 years of master's, approximately 1 year of internship.
Okay. So now let's get into another question from the chat. What classes did you have to take at San Jose State University to become a dietitian?
Okay, so I had the advantage because I had already done my bachelor's and my master's post graduation from India. So most of the classes, when I came to this country, they recognized most of my classes from India. So as part, I did my master's in San Jose State University. So I did approximately 18 units over there, and then got an advantage of a lot of other classes. So overall, I had to take 5 or 6 more classes beside my master's and then the internship. So I did not have to undergo the 4 years of bachelor's program over here.
Okay. Another question from the chat. How do you apply science to the diets you prescribe?
So it is very important because when the diets we prescribe, it all depends upon the metabolism, the proteins, the carbohydrates, all the things which are happening in our kidneys is all based on science, urea, creatinine, BUN numbers, and based on those numbers, we prescribe the diets. So the GI issues, if there is a problem in the GI issue, then the body is, there is some kind of a disorder and it is related to the diet.
All right.
So whether it is a liver function, the GI function, the kidney function, it is all associated with nutrition.
Okay. So on to another question from the chat.
And biochemistry is very important, which is associated with nutrition.
Okay. On to another question from the chat. When you are handing out food to your patients, do you put certain medicines in the food or no?
Okay, so I don't give medicines to the patient. It is the nurses who gives medicines to the patient. Generally, we don't put any medicines in the patient's food because it does not taste the food. Second thing is sometimes when the patients, they know that there is medicine in the food, they don't want to eat that food. But there are some patients, those who don't like to take their medicines. For example, if the patient has dementia and the patient does not like to take the medicine, so the nurses take the doctor's order, and if the doctor's order is there, then they mix the food medicine in the food, like applesauce or pudding, which helps them taking it better, because if it is sweet, they don't taste the medicine.
Okay. And just building off of what you just said, do you work with people who have eating disorders or people who have other physical medical conditions, or do you only work with like regular people?
So I work with all kind of patients, whether eating disorder, heart conditions, kidney failures, cancer patients, demented patients, patients with behavior disorders, and those who have immediately got a surgery and they came for the rehab. So I work with all kind of patients.
Yeah, and building right off of that again, how do you deal with eating disorders like anorexia?
So in my hospital, we don't get patients with eating disorders like anorexia, but there are other specialized places where they treat the patients with eating disorders. But in my hospital, we do get sometimes patients with anorexia. Again, there is an important role which the counseling, the patient one-on-one interaction with them, giving them the confidence as an RD that what you are saying, it's good for them. Once they get the confidence, they tend to follow whatever the dietitian it tells them. So it's very important to work on one-on-one basis with patients with eating disorders. And again, we try to give them the nutrition education, explain them the risk and benefits, try to give them the food of their choice, give them small and frequent meals, and on the side, we try to have some personal relation with them so that they get that trust in us.
All right, awesome. So as you mentioned, you work in a hospital, but someone's asking, where else can you
But
work as a di-?
there is one more thing. If somebody has an eating disorder and the patient is still after all this does not want to eat, then as a dietitian, I consult with my doctor, and the doctor also tends to give some appetite stimulant medicines to them.
Okay. So as I was saying, as you already mentioned, you work in a hospital, but can dietitians work in any other places rather than hospitals, such as cafeterias or kitchens or anything else?
Yes, of course. So it all depends upon your interest as a dietitian. Um, I I work in a hospital because I want to work with all kind of patients, but there are some dietitians, they work only in the renal setting, like in dialysis centers. There are some dietitians, they work in the radiation department. There are some dietitians, they work in food cafeterias. Some even work independently as consultants, or some, as I mentioned, there are specialized clinics for patients with eating disorders, and they work there and help only specifically those patients with eating disorders. So there are community dietitians also, those who work in the community, like in food service departments, in schools, or they give the cooking classes in the schools and educate kids. There are some dietitians, they work in the communities and in the food banks. So it's a big scope of dietetics out there.
Okay. Someone just put in the chat, what benefits do you get from a good diet?
You become strong physically, mentally, and you become emotionally strong with a good diet.
Okay. A person
And
mentioned,
the good diet, it always helps in treating many other patients and many other medical diseases like depression. It can help you treating the, so if someone has heart problem, what do you think is important in a heart problem? First thing important to treat a heart problem is good diet. So a good diet is cure for every medical condition, not only medical condition, for the teenagers, for students, they all need absolute nutrition and balanced diet. Only they can achieve better grades in their schools also. And if they are getting good diet, they are less prone to get obese, and obesity can also reflect on their personalities.
okay, another person mentioned earlier in the chat, so without the license, you can't be a dietitian.
No. So out in the, there was that everybody used, there some people, those who think that they have some knowledge of nutrition, they used to call them nutritionists, but without license nobody can call them as dietitians. So that's why California American Dietetic Association, they have identified registered dietitians as registered dietitian nutritionist, so that only the licensed dietitians who undergo through all those rigorous schooling are eligible to practice as a registered dietitian.
Okay. Do you have to use other subjects than science in your class, in your profession?
So when I was in the school, yes, I had biochemistry, I had physics, I had chemistry, I had biology, English. We have to do a lot of reading, writing, because we have to go through a lot of journals and researches, read about them, write about them. So English was one of the most important, and physics, chemistry, biochemistry, practically all science related subjects,
Okay.
in addition to the nutrition and food science subjects.
All right. Um, Another question in the chat is when the patient has a diet problem, does the doctor hand the patient directly to you? So meaning when the patient or when a doctor realizes that a patient's coming into their hospital or to them at least, and they have some sort of thing wrong with their diet, does the doctor immediately contact you to help them out?
So when the patient is admitted, they generally come with a prescribed diet from their doctors. Like if the patient has a heart problem, they are admitted with cardiac diet, or if the patient has renal problem, they come with renal diet. But again, as a dietitian, it is my responsibility to assess those patients. If the patient is not eating good, or if the patient, depending upon their labs, do they, sometimes the patient has decline in their renal function but doesn't, and they are not eating good. So again, we have different ways to make them eat better, but I always talk to the doctor, and then once the doctor approves it, I do my recommendations, and we try to liberalize the diet, and we try to modify the diet as it is required for the patient's medical condition. And if they are eating good, then there is a different approach to it. So it all depends how they are eating, how good or bad their labs are, and what is their age and what is their medical condition. So for example, for the kidney function, there is different. If sometimes there can be just an acute renal failure, which means it is temporary shutdown of the renal function, or sometimes it can be a chronic kidney disease. Again, it depends if it is on what stage it is, stage 1, stage 2, stage 3, or stage 4, or end of renal failure. So as a dietitian, I see what kind of medical condition the patient has, and then I prescribe the diet and discuss the diet with the doctor. As per the California rule, whatever the dietitian prescribes the diet has to be in the hospital setting, has to be approved by the doctor.
Okay. So you mentioned earlier in your college phase that you had to take 3 sets of internships in order to become a registered dietitian. What exactly did you do in those internships?
So for the clinical part of the rotation, I work under the registered dietitian, and whatever the registered dietitian is doing, initially for first few weeks, I observe what she is doing. And then after that, she starts handing me the assessments she is doing or the work she is doing. And I'm doing that work, but she's signing me off that work. So I'm getting the opportunity to work closely with the registered dietitian in the clinical part. For the food service part, I'm working in closely with the food service manager in the how they are handling the kitchen operations. In the kitchen also, there are lot of regulations over here that they have to follow, whether it is dish room, it is production, it is the tray line, it is ordering the food, and how to maintain the sanitation of the kitchen. Then on the side, I was working with the dietitian how to do the menus, how to approve the menus and follow the menus. In the community rotation, I worked in a school, in one of the schools at San Jose. And in that school, we used to make a lot of fun games and teaching material for the students. And then we used to go to that school and we used to conduct the classrooms over there. So I did my community part in the school over here.
Okay. So I'm gonna go to a couple pre-submitted questions real fast, and then we'll go back to the one in the chat, which was just put in. So this one person said, what kind of diet would you prescribe to a patient who was trying to lose weight, and what kind of diet would you prescribe to a patient who was trying to gain weight?
So it is not a standard diet for both of them, those who are trying to lose weight or those who are trying to gain weight. So let's say first, let's go by somebody is trying to lose weight. Again, when the patient comes in and the patient is, it depends on what is the BMI of the patient, in what category of obesity they are, and how much do they need to lose weight. How much is their ideal body weight percentage. Based on the, and what is their medical condition. So based on that, on the assessment, I do my assessment and I prescribe the calories according to the body weight, the protein requirements according to the body weight, the fluid requirements, considering all the multivitamins the patient needs. And if the patient needs to lose weight, I give my regimen to the doctor that the patient needs to lose weight. Once the doctor has approved it's okay for the patient to lose weight, then I adjust their calories, proteins, and accordingly how much they need to lose weight and according to their medical condition. So we can have them on low fat, low cholesterol restrictions. But then once the doctor has approved, I talk to the patient. It also depends on the patient's consent. If the patient says, yes, I want to lose weight, then I work in closely with them and give them different kind of dietary restrictions. Once they're on the dietary restrictions, then I follow up with their weekly weights and help them in achieving their goals. If the patient says, I'm comfortable with my body weight and I don't want to lose weight, then we cannot force the patient. I give them nutrition education. I try to convince them. I explain them the risk and benefits, but it depends on the patient's consent as well if they want to lose weight or if they are comfortable with their weight. Now, as far as the weight gain is concerned, there are different ways. Again, it has to be approved by the doctor that it's okay for the patient to gain weight. There are a lot of supplements over there. Oh, and the patient, those who want to gain weight, they really love ice creams. And there are different kind of ice creams like magic cups, which are protein and calorie dense, and they love it. Then there are other nutritional supplements like Ensure. Again, it depends on their medical condition. And if, for example, the patient has dementia, so they forget to eat. And I recommend feeding assistance for those patients and somebody feeds them, which help them in gaining weight. So it depends. There are some patients, for example, they have Parkinson's, and if they have the shaking of the hands, then if they need feeding assistance, we provide them feeding assistance to gain weight.
Okay. So this one kind of just directly bounces off what you just said. What type of feeding assistance can you give?
So the feeding assistance is generally given by the nurses. They are called CNAs. Those who work closely with the patient, they are taking care of the patient in terms of helping them feeding, bathing, and those CNAs, they work under the licensed nurses. The CNAs help them in, there are different kind of feeding assistance program. So sometimes the patients, they say they are comfortable feeding by themselves. But sometimes, like I mentioned, some patients, they require only limited assistance, like just open the lids for them, set up their tray, provide them limited assistance in form of just cut their food if they are having hard time cutting their food. Now comes second is the extensive assistance, which means some patients, they prefer to, after the limited assistance has been provided to those patients, they want to eat by themselves. But if they are not able to eat good by themselves, then the CNAs help them feeding them. So that is called extensive assistance. The third is the one-on-one feeding assistance, which means the patients are not able to feed by themselves and somebody feeds themselves.
Okay, and on to what seems to be the last question from the chat. What type of diet problems do you see and how do you mitigate them?
So the diet problems, which uh, can you specify more on what do you mean by the diet problems? Is it like if the patient is non-compliant or what?
Yeah, I think what this person is trying to say, but I'm not gonna put words in their mouth, is like of course every day you have a lot of cases with a lot of different types of patients who have different kind of like whether it's a feeding disorder or whatever it is. Could you kind of elaborate a little bit more on those disorders and how do you solve them?
So there are some kind of so there are some patients, those who are non, so let's say compliant patients and non-compliant patients. Okay. So there are some patients, those who are non-compliant, which means they have some kind of a problem and the doctor really, for example, they have kidney problem. Doctor really wants them to be on renal restriction. They are on dialysis and they have fluid restriction, but they are non-compliant. They don't follow that. Before they go to the dialysis centers, they go to the McDonald's and they eat from there and they drink from there. Or they order the food by themselves. So they're being non-compliant by not following the diet, which is prescribed by the doctor, and not following the fluids, which is prescribed by the doctor. For example, fluid restriction. They tend to drink sodas or extra fluids. So they become fluid overload and they may require extra dialysis session. So this kind of cases can happen in different other problems like a cardiac problem. So I tend to talk to those patients on regular basis, monitor their labs on regular basis. Sometimes we even monitor their weight on everyday basis to make sure that there is no fluid overload, and give them nutrition education, explain them risk and benefits, that it can really harm them if they are not following the proper instructions and the guidelines. Talk to their families, also make them aware that it is very important for them to follow what we have prescribed. Otherwise, it can be harmful to them. So this is the case where the patient is being non-compliant. Now, let's say if the patient is compliant and there are diet problems, I've tried everything, give them a lot of nutrition supplements, still the patient does not want to eat, and talk to the doctor gave them appetite stimulant which may help them eating better, still the patient does not want to eat. So then we do the care conference, and when all my interventions have exhausted, I have tried all the possible supplements, I've tried all the possible help, the doctor has tried all the possible medications in way the patient can eat. So then we do as an team care conference with the patient and the family, and we review with them that, okay, the patient is not eating. So we review different options with them. Do they want to have the trial period of tube feeding, which means the tube goes through the nose, it is temporarily, and they give the nutrition through the nose through the tube. Or this is temporarily for almost just few weeks. They cannot have it for long time because it is more of risk for aspiration. Or they want to get the tube in the PEG tube, which means through the stomach. And for that, it is a big process which they have to go through the surgery. And once they get the tube in the stomach and come back, then they get the special food which I monitor for them. So there are different kind of things which we have to consider. But our foremost goal is the patient should get balanced nutrition diet by mouth. All these interventions are very way in the end when we have tried everything possible.
Okay, with the last question from the chat, if the patient doesn't want to eat, but the family wants the feeding tube out in, does the patient have to do that, or do they have a choice?
You mean to say the family wants the feeding tube, but the patient does not want it?
Yeah.
Okay. So if the patient is alert and oriented, the patient has the right first. If the patient is alert and oriented, and if the patient says, I don't want the feeding tube, then what they say, that is being honored. Sometimes the patient is not in a state to make their own decisions, and they have somebody from their family who is responsible to make the decisions on their behalf. So what the family says, the responsible person, we go honor that. Sometimes the responsible person on behalf of the patient says that when the patient was alert, the patient had that wishes that if I will go old or if I will reach to that situation where I'm not able to eat by mouth, I don't want any feeding tubes. So then we respect whatever decision there. So it all depends if the patient is in a capacity to make their decision by themselves. If not, then the decisions are made by the families.
Okay, so we're almost done with the workshop, so I'm going to end it with this last pre-submitted question. Lastly, what advice would you give to the audience if they wish to pursue a career in dietetics? Like, is there anything where you went wrong, where you wish you could have done right? Is there any sort of like shortcuts or habits which they should develop? Anything like that?
So for the career of dietetics, as I mentioned earlier also, we know, we all know that if somebody is sick, what is the road for the recovery beside medication? Nutrition. So nutrition really plays a very important role in the road for recovery for any medical condition. And it is very satisfying for me by the end of the day to see if the patient comes on a feeding tube and if they are able to eat, and by the time they walk out of the hospital, they don't have feeding tube anymore and they're eating by mouth. It is so satisfying to see all those kind of experiences. There are some patients, those who were declining, they were not eating, they are eating good now. There were some obese patients, they had to lose weight for their medical conditions and they are in their good body weight right now. So it is very satisfying to see how a person can maintain a healthy and normal lifestyle with the correct nutrition. So it all comes from the heart and being a good team player.
Okay, so we're just about done with the workshop. Mrs. Bott, if you have any last words you'd like to say to the audience, now would be the right time.
I would like to thank you all for giving me this opportunity to let you know about how important the role of nutrition and dietetics is in the medical industry, especially in this time of the COVID, where we see because of COVID, if those who have COVID, nutrition is important to avoid getting them into the state of malnourishment or dehydration. Those who don't have COVID, again, nutrition is important. Because of the pandemic, we have seen there have been a lot of rises in the psychological disorders like depression. There have been a lot of eating disorders. People sitting at home don't have anything to do, just eat. So there have been a lot of cases of obesity. So in whatever situation we are in our life, nutrition is very important. And I love my profession. And if you are really interested in becoming a dietitian or knowing more about this industry or field in specific, you can contact Rishit and Mahir, and they can give you my contact number, and I would be very happy to help you on that.
Okay, so that's the end of the workshop. Thank you, Mrs. Bhat, and thank you for everyone who showed up. Our last workshop for today will be at 5:30, so stay tuned for that, and we'll see you guys there.
Thank you. Bye.
Bye.
Thank you.